Hello, I'm Sarah Key. Here we go, your stage 1 of my new Sarah Key Problem Back Masterclasses. The theory component, some 9 hours of fairly full-on stuff, which I hope really makes sense to you. I hope it all hangs together to make it easier for you, toiling away as you have done, at the forefront of the battleground really on dealing with the pandemic of back pain. So these are the texts I've primarily used for a lot of the source material. Clinical Anatomy of the Lumbar Spine by Nikolai Bogduk and Lance Toomey, Biomechanics of Back Pain, Mike Adams, his wife Tricia Dolan, Nick Bogduk again, and Kim Burton, Vertebral Manipulation, and Grieve. Now, these are the scientists on the left, the non-clinicians, and the ones on the right are the sort of therapist's manual, particularly the Maitland one. There are lots of papers, obviously, that are more recent than these books. The theory is presented by webinar here, but obviously this is only part of it, and we are practical therapists, we're manual therapists, we're physiotherapists, and really you're only half getting the information if you're not following up with the practical adjunct programs. These will be, initially anyway, taking place in the United Kingdom and in Australia. So, and what is covered in the practical adjunct programs, obviously very thorough assessment of the lumbar spine, using your hands to be absolutely accurate about what you're feeling. Remember, lots of people completely miss L5 just as they miss C1. It's a common problem with physios. Then, of course, the thing that excites everybody so much is learning to mobilise the spine with the foot, with the heel, which I've been doing for nearly 30 years. Just so much more effective, just so much more able to be done, and it's quite extraordinary really if you've got any sense of feel at all with your hands, and I very much hope you have. It takes but a moment to actually extrapolate that into using your heel. Advanced self-mobilising techniques for the patient to do themselves, which includes of course the back block, which I call pressure change therapy, and then also on the patient end of things, the patient participating in a spinal decompression class, which is pretty well integral to the Sarah Key method, using the back block. But there are other ways of achieving mobilising and decompression. But the other very important thing, and the final point, and possibly the most important point, is that the practical adjunct sessions have a lot of actual in the flesh patients who I haven't seen before, or who the other people who are running the programs have not seen before. So it's sort of not a setup. Patient coming in, us going right through the treatment of that patient, from taking the history and how long the history should be and what you should be looking for. I know you've been through this all before, but it's just good to see it in action, where I tell the patient to ignore the group and just focus on me. Then me taking the history, me doing the assessment, me doing the treatment, obviously me oftentimes, most times, mobilising that patient spine with my heel. And then, very importantly, putting it all down in a treatment summary, which I get down there and then. So what you need to do if you want to speak to us about coming to the practical adjunct programs is Sarah Bogue in Sydney, admin@sarahkey.com, and Federica Bertolini, admin.uk@sarahkey.com. So there we go. Look forward to seeing you. Hope you enjoy it.